Hello, dear friends. We are now in at the end of the second year of the pandemic, and probably we can analyze the different strategies in the nations. And as a pediatrician, I want to focus on the important part of the natural immunity in childhood. Interestingly, in September 2020, this paper predict what will happen in the next year by analyzing the natural and vaccine-induced immunity with social distancing and predict the evolution of the COVID-19 pandemic. With the help of this model, we now understand that SARS-CoV-2 don't develop permanent immunity in humans, but a waning immunity. Moreover, we understand that an uncontrolled pandemic lead to a very quick increase of death rate, but a very quick increase of immunity. In the controlled pandemic, we have a lower increase of death, but also less immunity. By using this model, we can understand the relationship between death rate and immunity based on the control of the epidemic. In a poor controlled epidemic, we have a higher death rate, and in a well-controlled epidemic, we have a lower death rate. But however, in a poor controlled epidemic, we have a higher immunity compared to the well-controlled epidemic. This model further explains the effect of social distancing on death rate and immunity. By a higher social distancing during a lockdown, there's a lower death rate, but also a lower immunity. This chart explain the effect of vaccination on death rate and immunity, and we understand that the effect depends on the duration of the immunity. Having a permanent immunity by vaccination, we have a low death rate and a high immunity. However, if the effect of vaccination persists for a lower time, there's a higher death rate and lower immunity. And we now have to realize that the death rate increased due to the low duration of immunity. Sweden has a well-organized public health system and now published the duration of vaccine effectiveness against COVID-19, against hospitalization and death. And now we have to realize that after 240 days or 6 months, only 20% are protected against hospitalization or death by vaccination. The same disappointing data are shown for adjusted vax effectiveness against symptomatic COVID-19 infection. Natural immunity is even higher, and we now understand the impact of the short duration of immunity after vaccination on the death rate that increase compared to natural immunity that have a persistent immunity for at least 12 months. We are now able to understand the real-world data as published in the internet. There are 3 countries with different strategies, as India, as an example for an uncontrolled epidemic with a high burden of death and diseases in summer 2021. However, today the disease rates are very low. In comparison, there is a Swedish way with an uncontrolled pandemic in children and a controlled epidemic in adults by vaccination. And we see again a high rate of diseases in summer and spring 2021, but today the Swedish people have no fourth wave. We have a very low disease rate in summer 2021 by control of children and adults and additional vaccination, but unfortunately we have a very big fourth wave. There are the published zero prevalence data in India with high zero prevalences in all age group due to natural immunity. For me as a pediatrician, and I think for most people, it is the most important question in this pandemic if natural immunity in children with COVID-19 is ethically justifiable. We have to know the risk of the acute disease in children. We further have to know the risk of the multisystemic inflammatory syndrome in children. We have to learn to know the risk of long COVID, and we have to know the implication of the strategy on the risk for adults. Looking to these data from Germany, there's a clear indication that nearly none of the children between 1 year and 17 years need intensive care for COVID-19. Although the death rates are very high in the older people, a little bit lower in the young adults, but nearly zero in the children age groups. This chart explains again the impact of age on natural mortality and COVID-19 mortality that even equal. And we try to explain these data with the autonomic nervous system measured by the heart rate variability. We have a very high heart rate variability in people between 1,000 days of life and 20,000 days of life. The younger and older people have a very low heart rate variability that may explain that they have a higher risk to die from COVID-19. And there is a window of opportunity for natural immunity in the age between 5 and 25 years. However, it seems to be very important to predict the individual risk of any patient to die from COVID-19. We developed this algorithm based on circadian heart rate difference and global heart rate variability in a 24-hour Holter ECG, and found that the risk is very good, demonstrated with increasing age. We prove this algorithm also in children with obesity and heart disease, and found that the risk is well detected by this algorithm, and published this algorithm in this paper. Multisystemic inflammatory syndrome in children is a special complication after COVID-19 caused on immunologic mechanism. We demonstrate a patient, an 8-year-old patient, who have this syndrome with very low heart rate variability. After receiving IgGs, the heart rate variability increased, the heart rate decreased, and the kid is healthy again. That is an important message that this syndrome is treatable, and the mortality in Germany seems to be zero. For a long time, we think that vaccination protect against the inflammatory syndrome, but as others, we have our first patient now published in vaccines, and we clearly see a release of autoantibodies in this patient, as also in patients with a natural inflammatory syndrome in children after COVID-19. And perhaps we have to realize that the vaccination don't protect against the multisystemic inflammatory syndrome. Our data now demonstrate that we have found such G-coupled receptor autoantibodies in children with multisystemic inflammatory syndrome after COVID-19, in children with long COVID syndrome, and in children after vaccination. However, what is long COVID? We think, as this publication by Starbuck et al., that it is a disease of the autonomic nervous system indicated by sinus tachycardia or post-oral orthostatic tachycardia syndrome. This 16-year-old girl developed a severe post-oral orthostatic tachycardia syndrome 2 weeks after BioNTech vaccination, and she goes to hospital, but the reason is not found. We analyzed her heart rate variability in 24-Holter ECG and found this tachycardia in situations with physical activity. She stopped her physical activity, of course, this tachycardia, and in the afternoon she's completely laying down because of this phenomenon. After Ivabradine, the mean heart rate dropped down from 96 to 77, and she has no tachycardia while standing, or slight tachycardia while standing, and we found an improvement in physical activity, and she recovered from this complication. This slide now demonstrates inappropriate sinus tachycardia in a girl with a long COVID syndrome for more than a year. She has elevated heart rate during the day with 104 beats per minute on average. By using propranolol, we decrease the heart rate to 85 on average. However, the girl further have problems that may be explainable by the development of antithyroid peroxidase and antithyroid receptor autoantibodies, as well as antimuscarinergic cholinergic receptor autoantibodies 1 and 2. And she had this clinical picture of her Hashimoto thyroiditis. I think for a pediatrician, this is the most important part of the COVID-19 pandemic, that is the development of autoimmunity triggered by SARS-CoV-2 infections. There seems to be a hyperstimulation of the immunologic system induced by the spike protein that leads to autoimmune disease. And indeed, the authors of this paper conclude that SARS-CoV-2 causes development of new onset IgG autoantibodies in a significant portion of hospitalized COVID-19 patients, and are positively correlated with the immune response to SARS-CoV-2 proteins. That may explain the identical clinical pictures that we see in children after the vaccination compared to the natural disease. By knowing these facts, I try to differentiate the Spanish and German way through the pandemic. We have a high disease burden in Spain in February 2021 and in October 2021, and lower disease rate in Germany. Based on this data, there is a higher death rate in Spain in the early pandemic, but a higher rate in Germany after December 2020. that may be explainable by higher vaccination rate. However, the vaccination differentiate only at the end of 2021 with a higher vaccination rate in Spain. What really happened? I think we have a earlier vaccination campaign in Germany, but the immunity don't held in the winter 2021, what may explain the fourth wave. Moreover, we have a lower natural immunity by a lower disease rate in summer 2021. If we have a lockdown in schools, that is not realized in Spain. Thank you for your attention.